Okay. Whoa. Okay, here we go. All right. Usually my mic should be straight. I always gotta go through this. This is just to go to show you preparation is very important. And getting ready for this is it's not a lot, but the preparation for it. You know, we gotta get it together. Gotta be on time. And I think that my volume is good. This is the problem. I always gotta, yeah, okay, yeah. Okay, it's not a lot, but my volume is good. Preparation. Okay, so you gotta get it to. So now that my volume is good, we can now get this show on the road. So okay, as I was saying, this was a lot, but it's not a lot anymore because we're live now. Right, we are definitely live now. Okay, so thank you for tuning in to tonight's live. It's Wednesday, November 20th, right? And today we're gonna cover a couple things today. And like I said, forgive me for not being ready, but I was actually resting. Yes, I was resting. I had um I had a doctor's appointment early this morning that required me to be at the be at my appointment at 6:45 this morning. So it was a interesting day. Okay, so oh my goodness. So okay, so we back again. 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 Okay, so today Wednesday, November 20th, and as always, I would like to start with covering why we are doing this live, and the purpose of this live is to energize and help anybody out there that are dealing with any issues. Oh man, dealing with any issues as far as recovering from anything. Not only recovering, because like I always say, everything is not about sickness, but everything can lead to sickness. So this live is to connect with anybody out there, connect with everybody out there that going through any struggles, especially those people in the hospital, connecting with those folks, giving them hope, letting them know that there is a other side, there is victory, letting them know, especially cancer patients, because that's what I associate with. That just because you're diagnosed with cancer, that doesn't mean anything except that you need treatment. That's all that means. And the ups and downs that comes with the treatment and the process, I'm gonna help you through it. I'm gonna help you through the whole process from beginning to end. So today I had a good day. Had to go to the cancer center. I had a appointment. Like I said, I had to do a checkup. But the thing about today was, I got to meet a very interesting gentleman today, and that's one of the things I spoke about before is about experience energy, the energy of somebody that is experienced or has some kind of experience in a particular field. It doesn't even have to be pertaining to, sickness, but somebody's experience can always help you, further, whether it be your education or your skill set, just getting better. You got to be open to conversation and open to opinion. You got to be able to take criticism. Sometimes people, they are haters out there, but sometimes you can even take sense out of the nonsense. You can listen to the haters and even do things better so they can hate even harder. But there are lessons that we can learn from people, and that's what I call experience energy now. when I was going through my, when I was first diagnosed, I was going through chemo. You know, any diagnosis is something that you have to deal with. It's tough, and it doesn't really matter what you're going through. If you was diagnosed with diabetes or a heart condition, somebody else that is going through the same thing as you're going through is going to be able to help you with your situation. So it's really that simple. Somebody already dealing with it. It's easier for you to take criticism. It's easier for you to take advice. It's easier for you to help yourself move forward if you have somebody that been through a similar situation. And you know besides the fact that everybody's ailment affects them differently, so you can't always expect the same result. If you apply somebody else's science to your situation, but similarities are there that you can pull from, and just apply that to yourself, and it'll make sense. It'll make sense. So when I was going through my process, I was first diagnosed. And one of my neighbors is a cancer survivor, right? And I always jump in and jump out. That's one thing that's very important. Shit. One thing is very important. Letting people know that you are a cancer survivor. Because if I didn't know that, I think I knew that before I was diagnosed. I think I knew he had cancer, but letting people know that sometimes too, because by me knowing that, I was able to go to him and speak to him, and doing the whole process. He was somebody that I could speak to and could take advice from, because nobody that I knew went through the cancer. My cousin, my cousin knows about a lot of these things. You know what I'm saying? The doctors and everything, but I never knew anybody that really went through, the cancer and all the ups and downs. So I was able to lean on him and ask questions, get advice, and able to felt felt like there was a victory. Feel like what I'm saying, I could come out on the other side. What I'm saying, still alive and present. And a lot of the things that he told me, a lot of the motivational things that he told me, like made a difference. Cause being diagnosed with three cancers is a heck of a thing, and it's scary. Best believe it's scary. There's nights where and days where you pull yourself, you gotta pull yourself together, and thankfully when you got people to help you, what I'm saying, that process is easier. But it's very important to have somebody to be able to reflect on, ask questions. It makes you feel like, okay, what the doctor's saying is true, because as a young person, 38, being diagnosed with cancer, it's like, cancer, like, what are you talking about, cancer? Like, I don't, why are you even talking to me about cancer? So to accept, if I was 70, 80, and I got diagnosed with cancer, it's like, oh well, that's to be expected. You know what I'm saying? But at 38, it was like, whoa. You know what I'm saying? It was a hit. So to have somebody to chop it up with that I could talk to, it was very important as a young person that didn't really know how to grasp the whole situation of being diagnosed with three cancers at 38. So it helped a lot. Um, so in the beginning, I had that, and it helped. So now, this gentleman that I met today, he's going through cancer, right? My friend that I spoke of, he was going through different cancer, right, in the digestive system. This person I met, he's going through prostate cancer. Now, he's a man of color as I am, and now in the black community, prostate cancer is very high risk, in the black community. And like I said, you 38. I know any man that's in their 30s not thinking about prostate cancer. Only if if there's history of prostate cancer in the family. That is something that you should take serious. If there's history of any cancer in your family, you should definitely be linking up with your doctor. You definitely need to be on a daily checkup. You definitely need to get a baseline to see where you're at. But um, that is very important. That is very, very, very important. So this gentleman that I met, he is going through like prostate cancer, and like I said, um, as a young person, we're not thinking about any cancer. But as a man of color, and because I've been diagnosed with cancer, I've been doing more research more and more, and I found out that people of color, we happen to get prostate cancer at a very high rate. Now, I was told that prostate cancer do not kill you because it can be treated, and that's like I always say, cancer don't kill you because it can get treatment. It's when and how you find the cancer and the treatment that you go about. That's where what I'm saying the numbers change. But cancer is treatable, and prostate cancer is very treatable. You don't die from prostate cancer. You die from the prostate cancer traveling to different places, and by the time you realize that this cancer then metastasized to so many different places, it's too late. And now, prostate cancer is the result of you being in a unwelcome situation. But me knowing that, what I'm saying, that's half of the reason why I'm doing this is to advocate, is to share with my brothers and sisters the information that I was forced to learn. You understand? I was forced to learn this information because I needed to know what's going on in my life. I said, with 40, at 38, I looked at my doctor and said, "Look, doc, I need to see another 40 years. What do I need to do? What do I not need to do?" And what I'm saying, my doctor looked at me and was like, "Yo, listen, man, young man, you need to go out there and enjoy your life." Yeah, that's what I'm saying. He didn't want me focus, or she didn't want me focus on what I'm saying, certain things, but I took it up on myself to because I needed to know for myself what's going on with my body and my situation. So, dove in and did a lot of research. So one of the things that came across my research was the prostate cancer and how that prostate cancer is so prevalent in our community. Now, like I said, we don't die from prostate cancer. It's spreading. And let me tell you something. Probably shouldn't be tell you this, but the prostate cancer is no joke. But these are the things you gotta do to stay alive. You know what I'm saying? It might be difficult, but there are things that you can do to save yourself, and the quicker you can do it, a better case for you. So, so knowing about prostate cancer is very important. So when I found out this gentleman had prostate cancer, I was like, wow, here goes somebody that I can speak to that can help me understand, you know, something about prostate cancer. Cause it's one thing to read, a lot of information, which the information is a collection of patients' results and doctor's opinion. But to speak to somebody straight on about a certain situation, it magnifies it, and it's is the person that actually. And another thing, that's this thing, they experience energy. This person has been dealing with this cancer for over 10 years, right? So when I see that, I'm like, okay, yes, 10 years. That's good. I'm trying to see 10 years. You understand what I'm saying? So that right there already motivated me to like speak to this gentleman and see what I can take from him to what I'm saying, to make my bill better. You know what I'm saying? Because of how he's able to survive. And one of the things that he poured into me about was doing the research, understanding your situation, reading, asking questions. He very much advocated to me how important it was to be active and to understand disease process, to understand situation, to understand what's going on in my specific cancer, not broad sense of it, what's going on with me specifically. And that is why he's able to be here today because the methods that he utilized were new methods that were the previous methods didn't work, you know. So he realized that he needed to try something different. So, you know, by him doing the research, he found out that there was something, you know, because I like I always said, they always working on something. They was working on a new drug. They was working on a new procedure, something new. So he found out about this new technology and was able to get access to it, and that helped him, you know, control the cancer that he was experiencing and also start fighting it back so he could, you know, regain control of his life and still be here 10 years later. So that the importance of somebody's experience of what they and what and how they went through a certain situation, that is like it's epic. And understanding just that, the possibility of success, the possibility of, oh, if he can do it, I can do it. And that is very that motivation is necessary. I think that motivation is specific to how we learn and how we adapt, because when you have to have people to fill in the gap. As an adult trying to teach a child something, it's easier that a child can learn from somebody slightly older than him than an adult, because that child that's like maybe 2 3 years older than the other child, it's easier for them to see themselves doing something that somebody's 2 years older doing than somebody 20 years older than them doing. You know, it's easier for somebody young to relate to somebody slightly older than somebody that's 20 years older than them. So that kind of leveling off is important for that support structure in order for you to recover from anything that you're going through. So that's one of the things that is important, is meeting people and letting people know your situation, because if this gentleman didn't share, you know what I'm saying, what he was doing or why he was there, I wouldn't be able to tap in. And that's one of the things that has been affecting me for a while, is the inability to tap in with folks because of my condition, because of my situation. And the fact that I got a chance to speak to somebody that is currently dealing with something that I um I'm not gonna say I'm fearful of, but I'm concerned and want to be alert and ready for. That was important to me, right? So we are here to, you know, help people but beat whatever issues that they might be going through, whatever your situation is. Today, I had to do an MRI. You know what I'm saying? I'm awaiting the results to do a biopsy. You know, it continues. The wheel continues to turn, and you just have to show up, right? You gotta show up every day and ready to fight for your life. Like, it's really that simple. You know what I'm saying? And sometimes all it takes is to see somebody that already did it or already had success at it for you to be like, oh, okay, I can do that too. You know what I'm saying? So a- all it takes is in my opinion, what it takes more, the most important thing that's gonna take to get you on that side is rest, and rest for yourself, right? Because this live stream is about 7 p.m. when your family, it's time for your family to leave, because that's the time that I spent in the hospital, and you are left, you know what I'm saying, to rest. And that's the most important time of any recovery, is giving your body the chance to actually recover, to rest and recover. So this is why I'm here at 7 o'clock, is to encourage those people that are either in the hospital or are dealing with anything, the importance of rest, the importance of a positive mindset, the importance of putting your mind and body in a place where you can utilize your surroundings and be prosperous, be positive, and win. Um, this is very important to me, because it is very. This is the reason why I'm here today, and why I'm able to give back. Because this is the stage in where, you know, you survive, and then, you know what I'm saying, it's a new life. It's almost like once you get diagnosed with cancer, the old life that you try to go back to, it's not there anymore. You have to make the adapt. You have to adapt to now going to the doctor every, you know what I'm saying? Especially right after cancer, you gotta go to the doctor three, four, five, times a month, or you know what I'm saying, week, whatever the case may be. You have to get adjusted to that, and then after you finish the treatment, then you gotta get adjusted to going for the checkups and finding out that something is wrong and going to get treatment. It's an ongoing battle, and this is my beginning. You know what I'm saying? I'm 2021, 3 years in. You know what I'm saying? So I'm battling, you know what I'm saying? And 3 years in, I'm still dealing with issues, things coming back. So, you know what I'm saying? It's just a process. But um, I want to show up every Monday, every Wednesday, every Friday to encourage people like me, people that are going through things, because it's very important for support. You know what I'm saying? Hit me, leave me messages in the chat. You know what I'm saying? My email is cancersilentkiller@gmail. Email me if you're going through anything. You know what I'm saying? Especially if you're dealing with any cancer issues. You want to communicate with me. You want to reach out. Hit me up on my Gmail, cancersilentkiller@gmail.com. You know what I'm saying? Shout me out. Leave me a message in the chat box. You know what I'm saying? And I can you know what I'm saying, talk to you directly and address whatever issues that you have. We are a community. We gotta come together to push each other forward. We can't let each other struggle. We gotta come together and help each other. This is very um, a big battle. It takes a lot of people, and it's gonna take a lot of more people, you know what I'm saying, moving forward to figure out the next stages and the next steps of cancer. Cancer is a big deal and a big issue because it alters your life. It alters everybody's life. You know, it's almost like having a baby. You know what I'm saying? Because I'm gonna be a grandfather soon. Everybody's life is about to change. You know what I'm saying, to make sure this baby is gonna be at the best. You know what I'm saying, that she can be. But you know what I'm saying, our lives are altered. You have to adjust. Your family got to adjust. Your loved ones, your significant other, your kids, your friends. You probably can't work no more. You know what I'm saying? Your life is going to go through an adjustment. And you know what? I'm speaking on my experiences. And I'm sure, don't know of any, but I'm sure there are people that went through cancer, did treatment, and went back to living their old life. I'm sure that's possible. I am definitely sure that's possible, but that's not my experience, so I can't really speak on that behalf. But as I go through this earth and I meet people that, you know what I'm saying, have survived, and sometimes when you watch some of these YouTube channels and you see these cancer interviews, and I'm thankful for that, to be able to look in and see the opinions and see new technology that's coming up. But the um when you see the opinions and you see the ages of these people in some of these chats, I was diagnosed with this cancer 10, 20, 30 years ago, and I'm still here, and that is this, that, and that. Like, those things are like, those are like, that's inspirational. And that just lets you know that person adjusted to their life and is able to still be here 20, 30 years later because they accepted the adjustment and they was able to incorporate that in their life, so they can it's an adjustment that I'm dealing with, so I know it's a lot, um and especially when you know cancer comes back, because you know I was a case of first diagnosed, right? First diagnosed. Now there's a now I there's a chance that my cancer might have came back. So now it's like, oh, what stage of my life am I in at the moment? You know what I'm saying? I might, be going into a different stage, but whatever the stage may be, seeing people already in that stage or coming out that stage is all I need to see. It's success. It don't gotta be me. All I know is I apply the same things to me, I should become successful as well. So when I see in these chats, these people that are like, survive whatever cancer for 20, 30 years, it's like, wow, if you can do it, then I can do it too. You know what I'm saying? So sharing is very important, but this life that we live, we have to accept it. We have to come to understanding that there is gonna be differences. Like I said, this is my experience. I am sure that people who have dealt with cancer and probably go back to the regular life. If you ain't know anybody that experienced that, please put it in the chat. Let me know if you know anybody that went right back to their regular life. You know what I'm saying? But you know, it's not doing your yearly checkup after you've been after you finish treatment. That's you're supposed to get checked up every year. You're supposed to get a checkout. So that's a regular thing. But dealing with the recurrence of cancer, that's something new. And 3 years into cancer recovery, you know what I'm saying? We're gonna see where this takes us, and we're gonna maneuver. We're gonna adjust, and we're gonna stay positive and keep showing up every Monday, Wednesday, and Friday to inspire and to help those out there that's going through the same situation as I'm going through, or not even, everybody's situation is different, but no man's situation is bigger than anybody else's. You know what I'm saying? No matter what age you are, everybody serves the same level of importance. So we gotta come together and see this through. And so like I said, the great thing about today is as I was able to share time and learn about something that is very prevalent in our community, which is the prostate cancer. Now, what I learned, which yeah, I already know, is the PSA test is how you recognize if there is an issue with your prostate, right? It's a certain antigen test where it picks up signals that there's issues with your prostate. So this is why the test, a checkup, is so important. Is that you need to know your baseline. You need to know where you're at. If you're above a two, you got problems. Well, not say problems, but you need to be getting checked out you need to be getting looked at for further checkout if you're above a two, right? I was above a two. You know what I'm saying? At one point in my recovery, I think about a year ago, I was above a two, and I had to undergo a prostate biopsy where they go in and they snip about 14, 16 different samples of my prostate to check if it was cancerous. Um, that was an experience that I'll never forget. But would I do it again? Yeah, to make sure I'm here, to make sure that I still get to see, you know what I'm saying, the joy of what the future brings. So PSA test above two, we need to know. As men, we need to know. You don't need nobody to tell you to go to the hospital. You need to take yourself to, not to the hospital, take yourself to your doctor. Know who your primary is. Do you have a primary? Get you a primary. You know what I'm saying? I don't, that maybe they should have emergency PSA tests at the pharmacies, just like you could take a pregnancy test. Maybe they should have a PSA test where you could just pee on a stick and it tells you if your prostate is messed up, right? Because we do not, um, come on, we don't do what we're supposed to. We sit around with pain, you know what I'm saying? And I'm guilty of that as well because I thought I was invincible. There's no way this pain can be nothing more than just this or just that, you know what I'm saying? So we have to stay diligent. We have to remind each other, and this is the thing. You're not doing it just for yourself, right? You're going and getting checked out for your family, for your son. You should an example. Now think about this. As as people, we gotta set examples. That's the best way to learn is through examples. So if your child, your son see you taking your health serious, doing certain things that's gonna make sure that you're around, it's gonna your kids are gonna feel that energy, right? They're gonna feel that energy and they're gonna feed off of that energy. And what your son is gonna see that. So once your son hit a certain age, what do you think your son is gonna do? He's gonna want to make sure his prostate is healthy so he could be around for his son. That's how this works, right? It's not just about you. Sometimes, if it's just about you, you would lay. I don't like to judge people, but you would remain how you are and not change, and knowing your situation is not good. But when you have when somebody else can motivate you to do things that you wouldn't do for yourself, that's the bottom line. And sometimes your kids is your greatest motivator. You know what I'm saying? So to set an example to your kids, to your daughter, and for a female getting a breast exam, that is like the ultimate. Um, that's just a part of being a woman is doing a breast exam, and I'm gotta check up for the ages, but as soon as possible. You know what I'm saying? As soon as you're supposed to get your breast exam, do it. Get your breast exam. What's going on, ma? That was painful. What part of it was painful? Let me know. Let me know what you're talking about. What part was painful? Um. Wow. It might be painful, but yes, ma. I might not have told you, but yes, I'm going through stuff, and we're gonna make sure that I'm okay. Right. So, what was I talking about? Wow. Whenever we lose our train of thought, we always come back to why we're here, and that is to help and elevate and to you know. Oh, the snippet of the prostate. Oh my good, was that painful? That was. Now remind you, I went through three. I did my first three chemo treatments without any painkillers because I was too concerned about um the effect of I was too afraid of the constipation that opioids could cause, and I was already dealing with issues. I didn't want it to get worse, so I did my first three chemo treatments without any painkiller. And one of the reasons I did it is I wanted to be here. I knew how serious my situation was, and I hope I don't remember what I started talking about. But I knew how serious my situation was, and I wanted to be here. And I was told about different people that experienced cancer and how they didn't fight, how they was doing chemo and they were supposed to do 5 6 treatments, but they got to the second one and the third one, but they didn't finish. You know what I'm saying? So when I heard that, I was like, all I gotta do is finish it. All I gotta do is finish it. Okay, I'm gonna finish it. You know what I'm saying? No matter the situation was, one thing I was gonna finish my chemo treatment. So if part of the obstacle was without the pain medication, I was gonna do it without the pain medication. And I'm gonna tell you, man, that was one of the craziest experiences in my life because it was over a period of months that I was going through this pain, but the biopsy was just a short period of time, and it was. Oh man, the biopsy was the worst pain. It didn't compare to the chemo treatment because it was 16, 14 to 15 snips. And what I learned, what I learned from speaking to my friend that I met today is they used to do anesthesia to do prostate biopsies. There was no anesthesia for me, so they numb you, but that numbing that didn't do nothing. Okay, it felt like it was one of the worst situations. And when I was going through it, I was like, hell no, never again will I do this. But guess what? I feel better. The pain stops. It goes away. So what is there to really complain about? Pain goes away. If you're able to heal yourself, majority of us are able to heal ourselves and the pain goes away. The pain will go away. Majority of the time, the pain will go away. If you have to go through something, At the moment, the pain will go away. Do not, do not um hold back, your future. Do not deprive yourself of life because of fear of pain. Pain goes away. Do not let pain stop you from living life and experiencing greatness. Pain goes away. So once that pain went away, in a moment, remember, in a moment, I'm like, oh my God, like it was crazy, man. It kept going back in and it kept getting snipping and kept snipping and snipping. But thankfully, I was um I was negative for any cancer for my prostate. So, we moved on from that point. The wheel kept turning. Now we turn around the corner and there's another situation and we're gonna figure it out and the wheel is gonna keep turning. But to my mom's question, was it painful? Yes, it was. It was definitely painful. Now, why did they stop anesthesia? I don't know. I have to do more research on that, but he said that he specifically requested a low amount of anesthesia so he can control the amount of snips, because he said that one of his friends experienced the biopsy as well. And they went in and they took 17 clips. But them 17 clips wasn't didn't show any signs, right? So they had to go back and take more clips, and those clips were cancerous. By the time he did his, technology was able to identify exactly where the malignant cells were, and they were able to extract those areas. So there were 6 areas that showed malignancy. So he said, "Listen, y'all only going to get 6 samples," and he told him not to give me a too severe anesthesia because I want to make sure, I want to count that y'all only took 6 samples, because his friend took 17 and ended up having to do the whole thing all over again. And he said he even said he has a friend that removed his prostate, and they still died of cancer. So these experiences is very important. So this is what he told me. So I gotta look into it. I gotta do more research about the anesthesia. But shit, I wish I had some anesthesia, man. I'm telling you that was something that was incredible. But like I said, pain go away, man. Pain goes away. All right. So do not let pain stop you from living your life and taking that next step, taking that next leap. You know what I'm saying? It could be, I was an athlete. You know what I'm saying? It could be pain of practice. It could be pain of getting up, going to practice, doing 2, 3 days every day in a hot summer. You know what I'm saying? I even have a story of when I was at football practice when I was new to the sport. I was running. I was very tired and very sick. You know what I'm saying? And I told my coach, I was like, "Yo, coach, I feel like I'm about to throw up." You know what I'm saying? And rest in peace to the great Coach Miller. Anybody knows what I'm talking about knows that Coach Miller did a lot for a lot of people, a lot of young men like myself. So rest in peace to Coach Miller. But Coach Miller looked at me and said, "Well, go ahead and throw up there, son." I was like, "You ain't gonna let me take a break or nothing like that?" He's like, "Nah, you gonna throw up, you gonna keep running." I was like, "Oh hell," you know what I'm saying? I was like, "I ain't with this," you know what I'm saying? Because I never experienced any of that, but because of family and friends, I had a older family member, and rest in peace, Floyd. You're not here, you know what I'm saying? Rest in peace to you as well. But he pushed me like, "Yo, what are you doing? That's not it." You know what I'm saying? You don't quit practice. You don't do these things. You know what I'm saying? He pushed me back out there, and then I realized, oh, this is the first time I ever threw up off exhaustion, exertion, or whatever, of running too much. And once I threw up, I felt even better. You know what I'm saying? And it was like, oh, there's certain things that I don't know, and this is a new area, so you have to not be so quick to give up on certain things just because you don't like, what I'm saying, the situation. So that was the first time I experienced, like, okay, pain goes away. There's recovery. Was when I threw up and I kept practicing, and I felt like, oh, I actually practiced better. You know what I'm saying, because of that. So experiences of people, of our, what I'm saying, our older ones, it's very important. It's very important to our recovery. It's very important to us moving forward. um is very important to the whole healing process, because somebody's teaching you how to heal. That's like somebody teaching you how to read or how to play a sport or how to do a job. Like learning how to heal, should be taken very seriously. And how I was able to do that is through proper rest, giving your body time to rest. You're not gonna get better in a week. You're not gonna get better in 2 days, 3 days. Sometimes it takes months and even years. So having a mindset that every day you wake up is a win. Every day you wake up and you see another day, it's a win for your body to get 24 more hours to figure out what's going on and for whatever medication to help your body fight whatever issues you have, and you know what I'm saying, come out on top. So today was a very interesting day, man, cuz it's one of the most important things is experience energy. The energy that comes from experience. The energy that comes from um it don't have to be somebody that went through the cancer. It could be somebody that works in the field. It could be a medical profession. Those experiences are all the same. You know what I'm saying? Being open to learning and doing the research and being active in patient care is like ultimately the one of the, if not the most important thing we need to do. So what I want to stress is doing your blood work, getting your checkup. Females, get your breast exam. Males, get your prostate checked out. Know your baseline. Know where you're at. So and the future comes, you know what I'm saying? And if you don't know, I'm telling you now, as you get older, you're gonna be more at risk to cancer. It's just how it goes. Your cells, they have a certain expectancy, and you know what I'm saying, they rock for a certain amount of time, and then they go. So, you know, when you hit about these ages, yes, that's why they don't like to give treatment, because recovery is like one of the hardest things. But through preparation, I believe that you be able to beat anything. You be able to beat any cancer, any ailment. Like I said, it doesn't have to be medical related. You could be going through, you could be trying to improve where you at in your job. You could be, it could be anything that's going on. Proper rest and a good mindset will help you. And remember, it doesn't have to be about medical, but if you don't get your problem situated, it will lead to a medical issue. It will lead to stress. It will lead to all these other things that can eventually have that effect in the long run, where you putting your body through stress in your 20s and your 30s and your 40s, man. By the time you hit 50, 60, man, it's gonna be a little bit too late. So you know what I'm saying, if at least, and this is maybe the most important thing, if you know that you're not living a healthy life, if you know you're not eating well, come on, you have to do the small things and just keep up with yourself. At least do that. You know what I'm saying? At least if you know you're not living well, you know, get checked up. Know where you're at. Come up with a plan. Where you're at right now, that's not where you have to stay. Come up with a plan. See yourself in a different place. You know what I'm saying? Envision a future for yourself that is better than where you are right now. And a lot of times, by you doing that, is gonna put yourself in a position to where you're not gonna be hit with you're not gonna fall. You're not gonna be hit with these things coming to you from the side, because you're focused. You know what I'm saying? You're focused on what you got to do to make sure that you're around and your life is at a certain place when you hit a certain age. Like I said, for me, being 80 years old is not enough for me. It's not okay to pass away at 80, 70, 80 years old. I'm trying to live to see at least 100, 120, or 110. 20 might be stretching it. But I believe through preparation, we can live to see those ages, and that's what my plan is, and that's what I'm preparing for. And what I'm trying to attempt is it might be damn near impossible, knowing my situation and what might be ahead of me, but it's possible. You understand what I'm saying? And that's all I need to try to see this through and see how possible it is. It is very possible for me to still be around with all the things that's going on because of technology, because of experience, because of all these things. So utilize the same reasons and the resources that I do, and you also utilize me as well in my 3 years of experience of being able to survive and be here today to inspire and help anybody else that dealing with this situation. And one of the things that is hitting me is the fact that kids also deal with cancer. That's like one of the things that it's hard for me to understand at the moment. And it's very it's crazy, man, how, you know what I'm saying, this cancer thing is so it affects a wide range, you know what I'm saying. So this is very obviously very personal to me, but this is why I want to show up, and I plan to show up Monday, Wednesday, and Fridays to give you that energy that you might not even knew existed. You know what I'm saying? Because, like I said, there's people in the hospitals that don't even have visitors. You know what I'm saying? And I had help, and it was hard for me to get to where I'm at. So, for you guys that don't have that, I know that it's hard. You know what I'm saying? But, being in a positive mindset is going to attract more positivity. And, you know what I'm saying? The people around you, they're the one that's going to make you better. So, you lean on them, and they're gonna lean on you, and put you in a place where, you know what I'm saying, you're gonna be better. So positivity, staying focused, resting, you know what I'm saying, those things are the most important things and most vital things to success and recovery. So we are definitely thankful that, most important thing, what I'm most thankful for is waking up every day. And I'm thankful to be able to do this. This is third live that I'm doing, and I'm very appreciative to be here to share my experiences and to see who and how it can affect somebody, because at this point in my life, um this is what I live for, is to help and have an effect on somebody going through the same situation, because it helps me a whole lot. Because I never stopped to I never stop to look around to see where I'm at. My machine is always going. So this is how I deal. This is how I process. This is how I'm able to wake up every day and be in a positive mindset, is because of how, you know what I'm saying, how I get up, and I attack every day, and I'm thankful for it. And so it's just special to me to be here to share and to encourage. And who knows what the future may bring, but starting something that's positive is gonna lead to more positivity. And there was many ways that I've been trying to help. There's been many ways I've been trying to give back. I've been trying to do blood drives, but it's a lot to get things organized. I've been trying to. I'm currently working on um, clothing that um, I use as I used to spread awareness. So it's many things that I was currently working on, but because of my health, I couldn't go outside this time. I couldn't go here, or I can't do this, or I can't be inside because too many people. You know what I'm saying? There's so many things I was not able to experience or do, that the only thing I can do is hop on this live and share, because I've been trying to help and share and make a difference for over 2 years now. And it's because of my health, I've not been able to get out there and do anything. So this is my way of giving back and sharing. And this is also, like I said, this is also therapy for me. So this also helps me process. This also helps me deal. This also helps me get up tomorrow and feel good about today, because now it's like, okay, Monday, Wednesday, Friday, I gotta get up. I gotta do this live. I gotta inspire. I gotta help somebody because, like I said, getting this set up, everything, it's not easy. But I'm here. I'm live, and that's all that matters. And if you are watching this and you're dealing with any issues, listen, man, stay positive, right? Stay positive. And one of the most important things I always tell y'all: understand where you at, know your medication, know what you're taking, be very aware. Be very aware. Just because you're in a hospital does not mean you get to relax. Do not relax. Be aware, be active in your patient care, know what's going on, and please do not stay in that bed all day, all night. Get up out that bed at least once, twice a day, and do 2 laps around any corridor, any floor you're on. Please get up and do at least 2 laps, because when I was in the hospital, I was in that state where I was not getting up. I was just, the whole thing was just, it was just crazy to me. Like I said, at 38, it hit me. 3 cancers. What's going on? But doctors was like, the doctors came in, you know. Very special guy. I don't want to say his name, but very special doctor. It was like, yo, listen, you need to get up. You need to get up. You cannot sit here or lay in this bed all day. You need to get up. You need to walk around this corridor at least twice a day, or else you're not gonna make it. He didn't say that, but I knew that's what he meant. You know what I'm saying? Because I was literally in the bed all day. You have to move. You have to help yourself. Give yourself a chance. You understand what I'm saying? You gotta help yourself. Help yourself. Move around. Okay, that's one of the things that very very important. Movement and mindset. Okay, movement and mindset. All right, and staying positive is the most important. So, um, sharing is very important. Letting people know, and that's another thing. Sharing with your family. Let people know your situation. Don't don't wait until you've been diagnosed with cancer, stage 4. Da 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 da. Don't wait till forever. That's like, don't do that. Let people know. Let people in. Let people know what you're going through. Don't be afraid to ask for help. You know what I'm saying? And don't be afraid to help. You know what I'm saying? We need each other, because main reason why you should help somebody else is because you're gonna need help in the future. Everybody goes through this stage where they're gonna debilitate. We're all gonna need each other. You understand what I'm saying? So when we just start helping now, and so you know what I'm saying, it'll be here when you need it. You know what I'm saying? Start chipping in, start helping out, start, you know, making sure your family's okay. You know what I'm saying? So what if you might have to drop somebody to the doctor? You know what I'm saying? Sometimes, you might be saving somebody's lives, man. And please, people, do not put work in front of your health. When I was growing up, I used to hear a lot of adults complaining, talking about, I'm gonna miss work. I gotta go to the doctor and do this. I'm gonna miss work. Man, that job ain't that important. All right, your health is most important. All right, don't worry about the job. If your job cannot see how important it is for your health, then I mean, you need to figure out something else. Right? Do not put anything in front of your health. All right, share what's going on with you, with your family, with your friends, especially friends. Sometimes it's easier to talk to friends than family. Sometimes you don't want your family to hurt because of what's going on, but you need help. And sometimes it's not just the help of the doctor. Every oncologist is not the best oncologist for you. Sometimes you need to get a second or third opinion. You understand what I'm saying? So just keep that in mind. Stay positive and always remember to help the next person, because you're gonna need help one day, right? You're gonna be in a situation where you need a ride to the doctor, or you need somebody to check. And one of the very important things is, all of us are different levels of education. You know what I'm saying? You might need somebody that's above your level of education to help you understand. You know what I'm saying? What's going on in a doctor's office, or what's going on here. We have to lean on each other. You know what I'm saying? We have to help each other out. That's one of the most important things. Let your family know what you're going through so they can help you. And they can help you with the mental process. Because I mean, the worst thing you want to hear is you find out how sick somebody is after they die. I mean, that is a harsh thing to experience. But patient care, um, and being appreciative because cancer is crazy, man. I've lost three friends, three friends of mine. I've lost um, in their 30s due to cancer. Right, I lost more friends to cancer than gun violence. Okay, or any kind of violence. Right, cancer is my enemy right now. Right, I'm raging war against cancer because cancer took three friends away from me. Right, and it came after me as well. So this is personal to me. So if I can help you get over this situation, I'm not only helping myself, but I'm also helping my friends that are no longer here because everybody that I'm spoken so far are great people that have contributed and made a difference in people's lives. And you would not think that it's possible to get cancer at in your 30s, but I've lost three friends, man, at my age because of cancer. So, you know, just being appreciative of people, man. Spend time with your family, man, because you never know what's going to happen and, you know what I'm saying, what tomorrow brings. But staying in a positive state of mind is always the key. Is always the key. Positivity breeds more positivity. And, like I said, today's Wednesday. Friday is going to be our next live. We started last Friday. So, you know what I'm saying? We just glad for the opportunity to show up to make a difference in somebody's life. And please share this video, share this live with anybody that you know that currently experiencing anything in a hospital, or like I always say, it's not always about sickness or disease. It's other things as well. So if you feel somebody can benefit from this that's not going through that, please share this video with them. You know what I'm saying? Keep this in mind, and just stay positive and understand that recovery comes through resting, and recovery comes to everybody that believes in the future and believe in the possibility, you know what I'm saying, of what to come. You put all your things together, all your energy in the right place. Right, so this is the energy transfer. I believe in the transfer of energy. Okay, that's one of the main things that make why I'm here today is the transfer of energy. Right, you can hear somebody's voice on the phone line, and you can pick up on the energy. Right, I mean, call your peoples and let them know, how much, what I'm saying, how much they mean to you. You can see somebody on a video and see the energy. You know what I'm saying? So whatever gives you the motivation. Watching your favorite sports game, watching your favorite actor. Find whatever it is that gives you that adrenaline rush and tap into it, and just do more and more and more of it, so you can be in that place where you need to be. So I can see you here Wednesday, right? I'm sorry, not Wednesday. So I can see you here Friday, right? So I just want to thank everybody that has and are watching the videos, liking, messaging. If you have any questions, or if anything you want me to address or touch on, please leave it in the chat. Share this video, and just be here on Friday for the next live, because we're here to make a difference, to try to save people's lives. So you know what I'm saying? I hope this has had an effect on you and has changed your day, your life, maybe just a little bit. That tomorrow you're gonna wake up on a better side than, you know what I'm saying, that you previously did. Because every day we're granted another day to make our lives even better. Can you imagine that? You can make tomorrow better than today. Can you imagine that? Yeah. So go do that. All right. Thank you.